Welcome back to TV5 News at 9. Today we are talking about leg pain and recurring disc herniations with board-certified neurosurgeon Dr. J. Jaganathan. Thank you so much for being here, Dr. J. We appreciate it.
Morning, Bud. Thanks for having me.
Okay, we have a big topic today. We are talking about leg pain. So what causes leg pain and how do you treat it initially, Dr. J?
There are a variety of causes of leg pain, but the most common that we see related to the spine are discs that may be slipped, that may be pinching on nerves. And when it causes pressure on the nerves, it radiates down the leg in the distribution of the nerve.
And how is that treated, Dr. J?
So initially, it's treated with non-surgical measures, things like physical therapy, pain management, steroid injections. Oftentimes, if that doesn't work, surgery may be required, which is usually initially starts as what's called a laminectomy or discectomy, where we remove the disc that's pushing on the nerve. But one of the complications with that sometimes that you see is that the disc can reherniate, and that's kind of a situation that Ms. Trelfo is joining us today kind of underwent.
Okay, so yeah, let's get right to her. Hazel is here. She's a patient who had a recurrent disc. Tell us a little bit about your experience, Hazel.
Well, it started out with leg pain in my back. Didn't have no way of getting rid of it, so had Dr. Jaganathan's phone number, made an appointment with him, and told me to get an MRI. I got an MRI. He looked at it, and he said I had a pinched nerve.
Okay, so Dr. J, with Hazel, what type of surgery did you do for Hazel?
So initially, as we talked about, we did a surgery where we just cleaned out the nerve, but several months later, probably about 4 or 5 months later, the disc, Ms. Trelfo started having symptoms again, and we ended up going and in his case, we repeated the MRI, and it showed that the disc had reherniated. And in cases like that, there are two options. One is going in and taking the disc out again, versus doing what you call a fusion, where you go in and remove the entire disc so it can't reherniate. And one of the reasons in favor of a fusion in a case like this is sometimes it's mechanics. There are problems with the motion of the vertebrae that may cause the disc to bulge out again. So in those kind of cases, a fusion can definitively stop that. So you not only clean up the nerve, but you prevent that from happening another time.
Well, Hazel, we all want to know now, how are you feeling? How's your recovery and how are your symptoms?
I'm feeling fine. When I come out of surgery and out of recovery, I had no pain. I've had no pain since I've been home. I had some muscle spasms in my leg, and I had muscle relaxers. I took those. Everything is fine. I'm just waiting to get out of the brace and to get set loose.
Well, we are so happy that you're doing well. Thank you, Hazel, for telling us your story. We appreciate you stopping in today. Thank you.
You're welcome.
Now, Dr. J, if someone needs some more information about this topic, where can they go, Dr. J?
They could go to our website anytime, www.mi-neurosurgery.com, or they can contact our office, 989-701-2538, with appointment questions or any other questions.
Sounds good. Thank you for joining us, Dr. J. We appreciate it. If you'd like any more information about this topic, just head on over to the hot link section at WNEM.com.